Hey folks, want to come on here and shoot another quick solo podcast. I know it is the run up to Christmas. If you want to go back and check out the Christmas episode, which is let me just double check. It is number 29. And we recently chatted to Dr. Muhammad, the voice of Gaza, Dr. Muhammad's story, Ireland, a journey through history and future. Navigating life in Dubai, Jodie's inspiring journey. So, a load of different topics, super interesting, and great conversations. Hopefully, you can take something away from each one of them. I kind of encourage you to maybe take one thing, if you want, one to three things, but maybe just one thing away from it. So, easy to remember. I wanted to jump on here and talk about a topic that's been top of my mind for the at least last 4 years, on and off, and that is the topic of mental illness. I was reading a book recently by Jonathan Haidt called The Anxious Generation, and how the great rewiring of childhood is causing an epidemic of mental illness. Boundlessly wise and engrossing, or boundlessly wise engrossing, the New York Times. And super interesting. I don't know Jonathan personally. It's an international bestseller. I just picked it up I was in Dundrum, and I picked it up in DeBarry bookshop. And I thought I'd touch upon this topic for about 15 minutes, especially on the run up to the holiday season, which they call it in the US. I know some listeners in the US. In the UK, they call it or just the festive season or Christmas period. So anyway, we'll touch upon this. We'll dive into it real quick, and yeah, we'll wrap up at the end with something. So real quick, I'll preface this by saying previously was on a break from my health for about 4 years, and I learned quite a bit about this whole area. Now, I'm not a doctor or a psychologist or a psychiatric nurse or working in the hospital, so I just want to say that anything I go into today is based off my own experience being a patient with the HSE for 4 years for mental health. 3 years and 6 months, I think it was. 3 to 4 years anyway. It was definitely not the 4 years, about 3 years and 6 months. I have to double check that. So definitely 3 years. 3 years and 6 months, 3 years and 9 months. So I'll talk about this topic and we'll get into it. And yeah, it's time of year where people come together with communities. So, and sometimes people may feel lonely. This time of year may not have a community that they can be a part of. We may touch upon communities on another topic. But yeah, let's talk about mental illness a bit. So, mental illness is an umbrella term that refers to a wide range of conditions that affect a person's thinking, emotions, behavior, or ability to function in daily life. These conditions vary in intensity and duration, and anyone can experience them. Here's a clear, simple overview. I'm just on ChatGPT here, so I'm just going to overview this. You could say that I'm a bit of I'm not a doctor, as I already touched upon, so give me a bit of space here and let me just talk about this from personal experience as well. What mental illness is: changes in thoughts, mood, or behavior that causes distress or difficulty functioning. Can be short term or long term. Can affect anyone regardless of age, background, or personality. Common types: anxiety disorders, e.g., generalized anxiety, panic disorder; mood disorders, e.g., depression, bipolar disorder; trauma related disorders, e.g., PTSD; psychotic disorders, e.g., schizophrenia; personality disorders, e.g., borderline; antisocial; eating disorders, e.g., anorexia, bulimia; substance use disorders; possible signs: persistent sadness or hopelessness; excessive fear, worry, or irritability; changes in sleep or appetite; withdrawal from friends or activities; difficulty concentrating; extreme mood swings; thoughts of self-harm or harming others. What causes mental illness? Usually a combination of biology, genetics, brain chemistry, environment, stress, trauma, difficult life experiences, lifestyle factors, sleep, social support, substance use. Treatment options: therapy, e.g., CBT, talk therapy, medication, antidepressants, antipsychotics, etc. Lifestyle support: sleep, nutrition, exercise, support networks, family, friends, peer groups. If you or someone else is struggling, you can tell me more about what you're experiencing. I can help you guide, and that if there's any risk of self-harm or harming others, if it's important to contact the emergency services or crisis hotline, it is important to contact emergency service or crisis hotline immediately. On episode 12, we touched upon Suicide Prevention Month, and there is an aspect of this whole thing, crisis and a crisis management. If you are out there during this Christmas season and you are suffering a lot and you happen to stumble upon this podcast, again, I'm not a doctor or a nurse, but please reach out to Pieta House. They have a free 24/7 crisis helpline. This is not sponsored by them. It's 1-800-247-247. Text help to 51444. That's on episode 10, Suicide Prevention Month with Brian Kingston. And also notes in that episode that over 40% of Irish adults have a mental health disorder and 1 in 10 have attempted suicide. And that's from MU, NCI, and Trinity College Research. And there's an article in the ad below. One sec. We'll just get into this a small bit more for those of you that have never experienced any sort of mental health difficulties or mental illness, or don't know anyone that has maybe gone through it. I will just talk about it a bit in a bit more detail. Here's a deeper, more detailed explanation of mental illness, broken down into clear sections, and I'll go into the book in a sec, so you can explore the concept at a more advanced level. What is mental illness in depth? Mental illness refers to clinically significant disturbances in thinking, emotion, regulation, or behavior that reflect dysfunction in psychology, biology, or developmental processes. These conditions affect a person's ability to function socially, academically, or occupationally. Mental illnesses are recognized in diagnostic systems such as the DSM-5 Diagnostic and Statistical Manual of Mental Disorders and the ICD-11 International Classification of Diseases. Number 1, how mental illness works in the brain. Mental illness is not caused by a single factor. Instead, it usually arises from an interaction of, we already touched upon this, we'll go into a bit more detail, biological factors, genetics, many conditions, depression, bipolar disorder, schizophrenia have heritable components, neurotransmitters, imbalances in systems like serotonin, dopamine, and norepinephrine can affect mood, motivation, cognition, and reward. I think that's how you pronounce it, norepinephrine. Let me just double check. So, norepinephrine, I think that's how you pronounce it, can affect mood, motivation, cognition, and reward. Brain structure slash function. Imaging studies show differences in regions like the amygdala, fear slash emotion, hippocampus, memory, and prefrontal cortex decision making. Psychological factors, cognitive patterns, e.g., negative self-beliefs, rumination, trauma, and early life stress. Coping skills and emotional regulation abilities. Environmental slash social factors, poverty, discrimination, chronic stress, relationship conflict, isolation, substance use, exposure to violence, or instability. 2. Major categories of mental illness. We've already gone into this overview, just going a little bit more depth. Anxiety disorders characterized by excessive fear or worry includes generalized anxiety disorder, phobias, panic disorder, and OCD. Mood disorders involve disruptions in emotional states, includes major depression, dysthymia. I've never heard of this one sec. Dysthymia, and bipolar disorders. Psychotic disorders include hallucinations, delusions, and disorganized thinking, includes schizophrenia and schizoaffective disorder. Neurodevelopmental disorders begin in childhood, includes ADHD, autism spectrum disorder, and learning disorders. Trauma-related disorders triggered by traumatic events includes PTSD and acute stress disorder. Personality disorders long-standing patterns of thought/behavior that deviate from cultural expectations and cause impairment. Example, borderline, narcissistic, avoidant personality disorder. Eating disorders, serious disturbances in eating behavior, body image, and metabolism. Examples, anorexia, bulimia, binge eating disorder. Substance use disorders, compulsive use of alcohol or drugs despite harm, includes addiction and dependency. 3. How diagnosis works. A trained mental health professional, psychiatrist, psychologist, clinical social worker uses clinical interviews, behavioral observations, standardized assessments, medical history, a DSM-5 diagnostic criteria. Diagnosis does not rely on a single test. It's a pattern of symptoms over time. Treatment approaches, which we already touched about: psychotherapy, CBT, cognitive behavior therapy, changes unhelpful thinking patterns. DBT, dialectical behavior therapy, emotional regulation and distress tolerance. Psychodynamic therapy explores unconscious conflicts. Exposure therapy for anxiety and trauma. Family therapy, group therapy, etc. Medication used when symptoms are moderate to severe or when psychotherapy alone isn't enough. Types include antidepressants, anti-anxiety medications, antipsychotics, mood stabilizers, stimulants for ADHD, lifestyle and social support, sleep regulation, physical activity, balanced diet, social connectedness, stress management techniques, avoiding substance misuse, combined treatment for many conditions, e.g. major depression, bipolar disorder. A combination of therapy and medication, plus medication, is most effective. Number 5, stigma and misconceptions. Common misconceptions: mental illness is a personal weakness. False, it is a health condition. People with mental illness are dangerous. Most are more likely to be victims, not perpetrators. You can just snap out of it. Recovery requires treatment, support, and time. Reducing stigma improves outcomes. 6. When to seek help. I really just want to reiterate that point. Reducing stigma improves outcomes. I've never heard that sentence or never heard it in that way before. Reducing stigma improves outcomes. Number 6. When to seek help. Seek help if you or someone else experiences persistent sadness, fear, or overwhelm, changes in sleep or appetite, loss of interest in activities, trouble concentrating, withdrawal from others, unusual thoughts or perceptions, feelings of worthlessness, thoughts of harming oneself or others. And if you want, I can go deeper into specific mental illness, how mental illness affects the brain, the role of trauma, treatment methods, early warning signs, myths and misconceptions, how to support someone with mental illness. How to support someone with a mental illness. If you know anyone going through it this Christmas, I just would like to talk about it because maybe you're a little unsure. It's 2 minutes left, so I'll just touch upon this. How to support someone with mental illness. Supporting someone with a mental illness can make a huge difference in their recovery and well-being. Here's a clear, compassionate guide on how to do it effectively and safely. Number 1, start with understanding. Learn about their condition if they're comfortable sharing. This helps you respond with empathy rather than judgment. Every illness affects people differently. Symptoms can fluctuate day to day. Their behavior may be influenced by the illness, not who they are. Number 2, listen without judgment. Often people don't need advice, they need to be heard. Do use calm, open-ended questions. How are you feeling today? Validate, that sounds really hard. Let them talk at their own pace. Avoid minimizing. You're overreacting, fixing everything immediately, giving unsolicited advice. Number 3, encourage professional help gently. In brackets it says gently. Suggest therapy, counseling, or a mental health checkup if appropriate. You can say, have you thought about talking to someone who could help you through this? If you want, I can help you find a therapist or go with you, but don't pressure them. We have a minute left, so I just want to be mindful of this. Number 4, be consistent and reliable. People with mental illness often feel like a burden. Showing consistent support helps rebuild trust and stability. Ways to show reliability: check in regularly, follow through on what you say, be patient with slow progress. Help with practical tasks. Mental illness can make basic tasks feel overwhelming. You might help them with, making appointments, cleaning or cooking, running errands, breaking big tasks into smaller ones, Always ask first, would you like help with this? Encourage healthy habits without sounding pushy. Support routines. I think we're just going to go with 15 minutes, so be very careful. I'll try not to make it too long. Without sounding pushy, support routines that improve mental health, sleep schedule, daily movement or fresh air, eating regularly, reducing drugs/alcohol, engaging in enjoyable activities. Make it collaborative, not corrective. Want to go for a walk together. Number 7, respect their boundaries. They may need space sometimes. Don't take it personally. You can say, I'm here whenever you're ready to talk. 8, watch for warning signs. Know the signs that they might need urgent help. Talking about self-harm, sudden withdrawal, severe mood changes, confusion or hallucinations, expressing, jeez, Christmas time, expressing hopelessness or wanting to die. If you think you're in imminent danger, contact emergency services or a crisis hotline, which we already talked about, Pieta House, so I'll add this in again. Even if they don't want to, safety comes first. 9, take care of yourself too. Supporting someone can be emotionally draining. Remember to set boundaries, rest, seek support, friends, family, or a therapist. Avoid trying to be their only lifeline. You cannot pour from an empty cup. 10, small things matter more than you think. Even tiny gestures can make a huge impact. Sending a supportive message, remembering important dates, sitting with them quietly, sharing a meal or activity. Your presence can be grounding and comfortable. I think I'll leave it on that. We're just over 15 minutes. That small things, I suppose if there's one big takeaway, rather than going into things too much, one would be to contact Pieta House if you're seriously going through a crisis right now, or go to a hospital or emergency services. But if you're not, and if you're someone that's just out there that's maybe suffering, or you know someone that's struggling with maybe just a mental health issue or mental illness, which you already talked about, mental health, the one thing I suppose is small things matter more than you think. Even tiny gestures can have a huge impact. Sending a supportive message, remembering important dates, sitting with them quietly, sharing a meal or activity. Your presence can be grounding and comfortable. I think I'll leave it there. I don't want to run too far over. And if you really want to check out the book, we already talked about it. It's called The Anxious Generation by Jonathan Hadid, or Jonathan Hadid. Hadid had it. Sec. Yeah, I think I'm talking about it a little bit too much. But yeah, back to the one thing. Small things matter more than you think. Even tiny gestures can make a huge impact. Sending a supportive message, remembering important dates, sitting with them quietly, sharing a meal or activity. Your presence can be more grounding and comforting. So yeah, thanks for listening, folks, and have a wonderful rest of your Wednesday.